Good afternoon, everyone. I think that obviously these are very difficult times in our community. It is obviously a time for us to, be the city of, and the state, the county of big shoulders, and I think shoulder to shoulder. Hopefully, we can address the many issues in our communities. I'm Alderman Byron Sigcho Lopez of the 25th Ward, and today, obviously, we want to make sure that as we've done week by week, we continue to provide information to our communities. We obviously have seen the disproportionate effect that the coronavirus, the COVID-19 has had in our communities. The number of fatalities in the African-American community, 70%. The numbers are staggering and they have been growing. So this was an opportunity, I think, as public officials, and we do have experts in the state, county, and the city level to come together to discuss kind of one of the resources that we have, the things that we're doing in our offices here in the 25th Ward. Obviously, we've seen, and I'm very glad that we have today all of our public officials in the area. I want to thank Senator Mattie Hunter, who has joined us and is obviously following this issue very closely, working with our office to make sure that on the ground we have the resources that we need, in our, especially in the most vulnerable communities, the African American Latino community. So I want to thank you, Senator Hunter, Commissioner Dennis Deere, another great advocate in the community. We've been partnering up in the county and the city to make sure that we also provide the resources in our community. I know that we're working, even though being just a few months in or newly elected, but I know that you have been also very, very gracious and helpful in the questions that we have and trying to provide resources. And also we have an SEIU member, activist who's been working as a healthcare worker, Lakesia Collins, who's also going to discuss with us the work and the needs that we have over there with healthcare workers. I know she's done a lot of great work there. And we have also Dr. As a guest from the Commissioner Deere, who has graciously helped us to have Dr. Joshi from the Cook County Department, who's going to give us information. So again, I want to thank you all for joining us here at the city level. We've seen the need of testing. I know that testing has been a big issue. Access to healthcare continues to be an issue. We've seen the issues in the environmental aspect of things that affect a lot. We saw what happened over the weekend in Little Village. We got a lot of work ahead of us. Here in the city, we were very fortunate, the U of I system, and I'm thankful again for the public officials who are supportive of all these efforts. We have now a new COVID-19 clinic in the 25th Ward, 1713 South Ashland, that is open now to all the community. We have an expanded pantry also to provide for low-income families that right now, obviously, there are unemployed. That employment numbers have increased drastically. We have seen obviously the issues also with infections. We're out there trying to provide the basic necessities. So I think we have a great group of people here joining us today to discuss the many efforts that we're doing at the city, at the county, the state. We I think with collaboration, with coordination, and also with advocates and healthcare workers like Lakesia, who are on the ground, making sure that workers are protected, making sure that workers get the basic PPE, adequate equipment to protect themselves, that together we can come out with policies to advocate for the Black and brown communities that right now, obviously, they are in fear, they're in concern about the pandemic. And we want to make sure that we get information out, that we get them the resources that are out there for them, state, city, and county, that we're working as a team. And that together, I think that we can create a community that is, and I've seen that in the solidarity, people coming together to make wellness calls for seniors, to deliver emergency kits to seniors with volunteers on the ground so that the information gets out. So this is another effort to make sure that we address the issues that we see. I know issues of health, issues of housing. So again, we're working together to respond the best we can. And we want to also, the second part, after we have our brief presentation, open it up for questions. So again, first I'm going to introduce again Senator Mattie Hunter, has been a good advocate and ally here to make sure that we address this issue, this pandemic, and we bring this solidarity between communities. So thank you for joining us, Senator Hunter, and thank you for being with us and share your information.
It is my pleasure, Alderman. Thank you very much for having me and all of the other distinguished guests on the panel. So by now, we all know that the Black and Brown communities, we're basically bearing the brunt of this COVID-19 pandemic. Last week, the Illinois Department of Public Health came out with some astounding numbers, in terms of 70% of Black residents has been affected. And African Americans, we only make up 29% of the Chicago population. In Cook County, Black residents account for 107 of the 183 COVID-19 related deaths. You see, I am in a very unique position because my district is brown and is Black, okay? And so as devastating as these numbers are, these results, they've been accumulating and they've been building for many, many years. The health and economic disparities that has gotten us to this point, it's nothing new. For the past 18 years, I've been passing legislation talking about racial and ethnic disparities in our community, and we get the bills passed, but not enough resources are coming into our communities, you guys. And so something that we all must do as leaders is step up, come to the table, and come up with a comprehensive, innovative plan to address these issues, because this is not only happening to Black folks in Chicago or Cook County or Illinois, it's happening all over the nation. And so we as leaders must come together to address this issue. And thank you very much.
Thank you, Senator Hunter, and thank you. I know that we'll be answering more questions, later on too, if they're from the public. But now I want to introduce Commissioner Deere, to maybe can share with us a little bit of maybe what we're doing in the county, or things that we need to be doing. And I also want to thank you for all your advocacy for Black and Brown communities that right now are struggling. So thank you, Commissioner.
Thank you so much. I appreciate you very much. Alderman Sigcho Lopez, I want to thank you for your advocacy. You have been in office since May, so it's almost a year now, but I was sharing with my good friend, Commissioner Brandon Johnson, that you hit the ground running, and you're always calling, and I'm calling you and talking about how we can work together. So I'm appreciative for you putting this together and continuing the advocacy work, because both of our districts are Black and Brown in it. And so we thank you very much. It is, and it's always good seeing my good friend, Mattie Hunter, Senator Mattie Hunter. Thank you so much for all that you do as well. You have been on this battlefield doing great work, and we are thankful for you. And thankful for all of the other individuals who are joining this call. Lakesia, thank you for the work that you've done, and for those that you will do. And of course, we're on the battlefield together. This is serious business here. I'm thankful that we just got some testing sites here on the west side and even on the south side. That is a plus. We know that this has been a disparity issue for quite some time. In fact, last July, I introduced a piece of legislation declaring racism as a public health crisis in Cook County. And so that is directly related to what we're dealing with now with COVID and the number of African Americans who are dying. This healthcare disparity stuff did not just start, as the senator mentioned. It's been going on for years and years and years and years. And yeah, I get it. People saying that this is all because of underlying condition. That's a fact. And research world, because I'm a PhD. In the research world, we call that stuff multifactorial, which means that there are multiple factors that contribute to a situation. So yeah, we may have some underlying conditions. The underlying conditions come from not having access to healthcare, right? It comes from those healthcare disparities. You have certain neighborhoods that you can take one bus, and ride 3 bus stops, and the life expectancy, it drops by 30 years, right? And that those neighborhoods are Streeterville. That neighborhood is Streeterville. You go to Streeterville, life expectancy is 90 years old. You drive 3 stops down to Inglewood, it dropped to 60. And so we have to begin addressing that. We can't start trying to address that when there's a crisis that takes place. Now is the time to start addressing it. So when the next crisis come up, guess what? We'll be prepared for it.
That's right.
Socrates said some time ago, if you always do what you've always done, you'll always get what you've always got. That's the definition of insanity, doing the same thing over and over again, expecting different results. And I'll kind of end with this. I am a psychologist by training, and there are mental health implications to this. In fact, I was sharing with you all before we got started that I think I'm going crazy sitting in a house, right? We know that there are individuals who have real mental illnesses, and you think we're having issues, they're having many issues, but you and I will have mental health issues, right? Because we are having COVID, and this whole coronavirus causes a mental stress, right? We've almost turned into germaphobes, right? We're cleaning all of our surfaces off. We are making sure we're mopping real good. And guess what? That causes a certain stress. The fear in and of itself will cause mental health issues for someone that didn't have mental health issues. And so there's a lot of anxiety, there's a lot of depression, and we have to be willing to suck that up and call out to our mental health providers so that we can get the help that we need. And so I am thankful again to have the opportunity to speak to this group, and I'm looking forward to the additional dialogue.
Thank you, Commissioner Deere. And now I think we're gonna have, obviously and I'm glad to have someone in the county with expertise on mental health. We've seen the issues as you mentioned. That's what they call for. That we have in our offices to volunteers and do wellness check-ins with seniors and people who are vulnerable. Definitely the check-ins and identify the need early, but the access, to mental health, the access, we very much, and I'm glad you and Senator Hunter have mentioned the limitations and the work that we need to do to, stress access and more resources so all communities can have access to that. So to maybe expand on that, I wanna, and thank you very much. We have two guests. I'm gonna start with, first the health aspect of it. I know Lakesia is gonna take maybe a little bit to this, talk about, from the healthcare providers aspect of it, the workers, but let's just start with Dr. Kiran Joshi from Cook County Department of Public Health. Maybe kind of give us some information about, what are you seeing in terms of the impact? What are the efforts that, that we're doing at the county, and in general, what is the situation right now with COVID-19, especially when it comes down to Black and brown communities where we see this staggering number? And thank you again for joining us in this call.
Thank you so much, Mr. Lopez. I really appreciate the introduction. Can everyone hear me?
Yes.
Great. Hi, everyone. So good to be here with such an august group. So I'm Kiran Joshi. I'm the co-director of the Cook County Department of Public Health, and we are the local health department for suburban Cook County. So let me just say, we are seeing considerably higher rates of COVID-19 illnesses and deaths, particularly amongst African Americans. In our jurisdiction, which is, again, suburban Cook County, the rate for African American folks is about 3.5 times that of folks that are white. Looking at rates by regions, the rate of COVID-19 in the south suburbs, which are predominantly Black, is 2 times what it is in the north suburbs, which are predominantly white. In the west suburbs, the rate is 1.5 times that of the north suburbs. So the data that I've been quoting are sort of specific to the African American population, but I want to say there are also concerning disparities in the high rates amongst folks that are Latino and also Asian. They're a little bit higher than the white population, but not as high as what we're seeing amongst African American folks. And not as marked, but again, still very concerning and very disturbing. We know that people of color have had higher rates of the underlying conditions that put them at risk for severe illness, complications, and death from COVID-19. Commissioner Deere mentioned this in his comments, and rightly, he indicated that these are a result of injustices, such as lower access to healthcare, but there's more, right? We know all about redlining and what that did in terms of the black-white wealth gap that exists today. We know that economic disinvestment has also played a role, lack of health insurance, food insecurity. I mean, the list goes on, right? We also know that in public health, there's a growing understanding that the underlying reason for these disparities is really structural racism, which is that the way policies are made disproportionately affects certain groups of people and disproportionately benefits other groups of people. If you visit our website at cookcountypublichealth.org and click on the banner, you could view all the data that we have by age, by gender, race, ethnicity, and geographic region, including you can see like a heat map that displays the number of cases and the rates by municipality. So these cases are the ones that we know about through testing, right? But we know that testing has been really limited, and it's been particularly limited in the south suburbs. And so I'm pleased to say that the state of Illinois has been working to address this gap and just opened a testing site in Markham. We do have a map on our website that shows exactly where all the testing sites are located, and I would encourage folks to check out our website and find out where a testing site is located near you. Now, just because a testing site is up and running does not mean that folks are comfortable visiting it, right? We know that because of policies that have been instituted by the federal government in recent years, there's a significant environment of fear amongst immigrant populations that are terrified that they or their loved ones will be detained if they go out and do things like seek the health care that they all deserve to have. And I'm really pleased to say that not only am I the co-lead of this health department, but I'm a doctor at Stroger, and it's really the honor of my life to take care of patients there. And I know that the other providers and the staff that work there feel the same about ensuring that there is equal access for all. So I'll stop my remarks there, and I look forward to the Q&A. Thank you.
Thank you, Doctor. Really appreciate it. Yeah, we do have some prepared questions, well, just to frame it, and then we're going to open it up for questions that come from the live stream. And now I'd like to obviously welcome the healthcare workers' perspective, because we wanted to add that component. We see obviously healthcare providers and they go and they take care of the seniors, particularly those who are particularly vulnerable. I'm really excited about the future work that Lakesia Collins will do with us, but want to make sure that we touch on that perspective that is important. But thank you again, Lakesia, for.
Hi, Alderman. Can you hear me? Can you all hear me? Okay. So thank you for inviting me to be a part of this discussion, and thank you to everyone else who are on the panel. The work that you all do every day is amazing. But yes, as a former healthcare worker, I used to work in a nursing home division, and I'm now currently an organizer for nursing home workers with SEIU Healthcare. And so what we're seeing is that there is a higher percentage of people dying in nursing homes. And because of a lot of it has to do with the short staffing crisis. Nursing home workers are working 2 to 3 times more than what the law allows. They are working in very dangerous environments. They have lack of PPE. They also have lack of supplies to work with. We are now seeing, it's even being broadcast over the news, workers are dying, seniors are dying. And this is something that has been, raised as far as concerns throughout the years around nursing home working conditions and the pressure that the workers have been put under. We have workers right now who have been retaliated against because they have taken action to demand proper, protective equipment, but also more staffing, hazardous pay. I mean, we have workers who are risking their lives going into work every day, not knowing if they're going to carry this virus back to their loved ones, and who are struggling with the mental part of it, of, stressing about their residents, their loved ones who cannot see them right now. And so, as far as the organizer right now, I'm just dealing with the calls about, being afraid to go to work. The workers that we represent are predominantly Black and brown men and women who take care of residents who are, predominantly Black and brown in the inner city. And so this is something that, we're raising national concern around. But the more workers that are speaking out, the more, the bosses are trying to retaliate against them. And so right now in this moment, I think that, we need to put a lot of pressure on the nursing home industry. They have to have accountability for what they're putting the seniors who are the most vulnerable at risk, and then also, what they're doing to the workers. And so I look forward to, continuing this fight that we've been fighting for a long time now.
Thank you very much, Lakesia. So now we're gonna have a few questions that are prepared, and then we open up to there's a few already. We already have a few from the public too. But first, I think, given obviously, and I think this is maybe targeted to Dr. Joshi, but everybody else who wants to jump in, by all means, can add to it. But given the high number, like you mentioned, the disproportionate effect, the triple amount of cases and fatalities in the African American community, how has the county, and maybe you can touch a little bit on how the county, the state, and city have adjusted their policies or resources to address that, and also, what else can be done? What already are doing, and what else we can do to prevent, further, this disproportionate number of cases.
Sure. Thanks so much, Alderman. Can everyone hear me? Yeah, okay. So first, I just want to say our health department's jurisdiction is suburban Cook County, and so I just want to be clear that I could only, really speak for our agency. And then I would say, I'm very real about the fact that the underlying conditions, like the structural racism that I mentioned, like that's not going to be overturned overnight, right? So I think we got to be real about that. But that doesn't absolve us as a government of our responsibility to address it as it is. So I think there are several strategies that we've taken and plan on expanding on to address this. One, I think, is just in terms of how we talk about things. I think we need to be explicit in our language about what the differences are and where we think that they come from. So I think calling out structural racism where we see it is really important. And the reason for that is that I feel like there is a toxic counter narrative that's out there. And I mean, I'm sorry to call out one particular institution, but if you were to tune into Fox News at any night, you would know exactly what I'm talking about, right? So I think we got to fight that a little bit. And I think it's our role to do that, because really what I'm saying is these are the facts, right? And it's as simple as that. It's as clear as that to me. So number one, how do we talk about things? Number two, I think it's really trying to engage with community and hear the community voice. And I'm not going to misrepresent what I'm doing here. I like to be very direct and transparent about our work. We're just getting started in this, but folks may be familiar with a recent initiative that we had programmed last year before the COVID-19 epidemic around STIs. And we really prided ourselves on hearing the community voice and engaging community stakeholders to help us develop that initiative, program it, refine it, and so forth. And our intention going forward with COVID-19 is really to do the same. in our response efforts around this epidemic. We were just talking about how, as a department, we can embed principles of health equity and social justice into our work, and hearing that community voice, I think, is a key way to do that. So we have a community engagement unit that's led by one of my staff, and she is tasked with sort of engaging folks from the community and translating their feedback to sort of improve our operations. I think there's a number of other things that I could speak to. I don't want to go on too much longer, but I think in terms of how we distribute the limited resources that we have at our disposal, I think we must keep equity in mind. And so, one of the initiatives that we just launched yesterday was to provide hotel rooms or housing for individuals that were discharged from hospitals with COVID-19. In my opinion, that intervention is going to disproportionately benefit Black and brown folks, because we know that there are higher rates of folks living in multi-generational housing. Folks have smaller homes. They may not have the space to isolate themselves in. And so I think that is a way that we can sort of work to address some of the issues there. And lastly, I would just say, I think we need to think really carefully about PPE and how PPE is being allocated. Our agency is not directly responsible for that. It's our Emergency Management and Regional Security Group, our department. And I've had conversations with them, and they've assured me that when they're making decisions about where PPE goes, and that's personal protective equipment, things like masks and gowns and gloves, for those that aren't familiar with that term, that they are keeping, community need in mind. So I said a lot there. If there are follow-up questions, I'm happy to respond to them.
Thank you. I know, unless someone wants to add to that, I know that, there's like I said, lack of resources seems to be. I know Senator Hunter mentioned that, getting more resources to, our public hospitals, making sure that access to healthcare is more accessible to our community, especially in the African American and Latino community. I think it's critical, the access to testing, in this case with the pandemic. So it's resources. So I know that Senator Hunter already alluded to that. I have another one. This is already, this is for you, Commissioner Deere, has already talking a little bit more in detail about the impact of mental health, during the COVID-19 pandemic. What is maybe the impact that you see, and I think kind of what are the efforts? I mean, I think there's a question to expand. I know you already touched a little bit on what do you think the impact has been. Specifically, I know, for instance, we've seen unfortunately a big amount of delays in services on mental health, given the closing of mental health facilities, right? And I think that
that's right.
Access, so that's one of them in the city. But I know, I don't know if you can expand on that. I think there's a lot of questions in terms of mental health, because almost physical and mental health kind of go hand in hand. So maybe you can expand a little bit, since your expertise. Thank you, Commissioner.
So thank you so much, Alderman. First and foremost, we have to acknowledge the fact that mental health, whether you're in the Black or brown community, is considered taboo. Most oftentimes, individuals don't want to seek mental health because if you have a mental illness in most of these communities, that means you're crazy. And of course, I say to people as a clinician that if you don't go and find a therapist or talk to somebody, then that's crazy, actually. And so COVID-19 actually compounds that a whole bunch more, because now you have individuals who did not have an official diagnosis of having a mental illness actually coming down with mental health issues. Now, those who actually had mental illnesses already, they're in a much worse position. First and foremost, there aren't a lot of mental health centers that are open. Fortunately, they made some changes in the law which did allow telehealth. And so a lot of clinicians are now doing FaceTime and Zoom and et cetera which does allow their patients to access mental health services. Now, what about the individuals who did not have a mental illness? Again, we go back to the taboo. Most individuals don't want to get mental health services because they think they are crazy if they do. And so what are some of the impacts of individuals who are dealing with mental health issues? Sure, there are many actually. There's anxiety that comes with individuals who are wondering if they're going to be diagnosed with COVID. There are fears that are associated with COVID. Every time you turn on the news, what's happening? You're hearing about somebody who has died of COVID, or you hear about somebody who was diagnosed with COVID. That sparks fear. It sparks anxiety. It also sparks individuals wondering what their future looks like, what their kids' future look like. Will they actually make it? Which even sparks more fear. And so those all contribute to an individual's mental health. Now, let me talk about how we can relieve some of that stuff. You don't need to watch the news so much. And I'm saying that, and I like to watch the news. I've always been a news junkie. But the more news that you watch, the more anxiety that you tend to find yourself caught up in. And so what I say to people is limit the amount of news that you watch. Although we don't have a whole bunch to do because we're off for the shelter in place, individuals keep their TV on and run the news on a consistent basis. Let's watch less news. You get your fix of the day because they're running the same stuff all the time. Watch less news, you'll have less anxiety, right? If you find yourself in a situation where you need to seek services, there is a whole consortium of services called the Behavioral Health Consortium. You can look them up on the internet. Behavioral Health, that is a group of about 9 different fairly large agencies that have come together. Majority of them are black agencies that are working with this. So it's called the Behavioral Health Consortium, and that you can call those numbers and they will work with you doing telehealth to work on your mental health services. In addition to that, you have to do some reading yourself. And there are many articles out there, if you're a news junkie, that talk about mental health services, signs and symptoms, etc. We have to take care of our own health. And part of taking care of our own health is making sure that we grab a hold of our own mental health and take care of ourselves from just as well as you take care of your hygiene and wash every day, you have to take care of your mental health. And so if there are any additional questions, I'm happy to answer them. That was a little blurb. I don't want to take up all of the time, but know that all of us have to take care of our mental health.
Thank you, Commissioner. There's a quick question, there's a follow-up in terms of, I think because it's relevant to what you said. The question is about, like, some people said that they sometimes call institutions like, you mentioned the consortium, that those services, are they available? Are they easy to access? Because some people sometimes find long, or at least experience like long waiting times. Had that being worsened, maybe given other people more calling? Or what do you see maybe in terms of the best way to get, your emergency access if someone is dealing with something? I think that's kind of.
Actually, people, the organization, their numbers are actually down. And so that tells you that people are not accessing the services that they would need. You would think they need to be up, but again, people are in fear. And a lot of people's time are wrapped up in trying to figure out how they can keep from getting COVID. I mean, one person that I know lost his mother and his father last month to COVID. And you just imagine something like that and the impact that it will have on them as well as everybody that they may know in their circle. The more death that we have from COVID, the more fear it sparks. And so the last thing, if you already had issues with talking to a clinician or psychologist, last thing coming on your mind is calling a mental health provider because you're grieving, you're trying to figure out how you can stop from getting this. And I would say to individuals who are listening to me, that should be the first thing that you do.
Thank you, Commissioner. I think now we're gonna open. I think there's a few, like now more, there are more questions. I think at least a few that we have in terms of, you know, people who are watching. This one has to do with housing. You know, in one of the complexes, Barbara Jean Wright courts in the 20, well, that's actually 25th ward. So they said that we, you know, there's like a lot of lack of repairs, critical repairs, a lot of sanitation issue, rats, critical repairs that need to be done, rehab. What are some, so there's a two-part. So what are the risks involved, you know, in terms of the health now that we have, you know, having, you know, this kind of sanitation? And I think this is, you know, and I can tell you that's been happening for a long time. But, you know, the two questions are what are the risks involved in this, and how can we commit as public officials quickly to a rehab plan to bring resources? I know this is a hot agency, so they said maybe we can sign, will you sign a letter to urge Congressman Davis to help us on this? That's the two-part question. So I wonder, maybe this first is like a health question on, you know, the risks involved with like the sanitation issues in some of the hot properties. Maybe the doctor, maybe Joshi can help us on some of these sanitation issues that maybe we're experiencing. I think this is in particular issues with rats, and you know, how can we, you know, move towards you know, hot. Unfortunately, on the federal level is being, you know, the administration is being a mess. So how can we advocate for changes given the situation? So I don't know, maybe that Dr. Joshi, you can help us, and maybe as public officials, you know, we can see, you know, we can respond the second part.
Yeah, I mean, obviously those sorts of conditions seem like they're less than sanitary. We do have some authority there, but generally we defer to, you know, the municipalities that make up the 125 suburbs that we serve. But we're certainly sort of in the loop. I would say the other part of the question seems to be like kind of like more of a policy advocacy question. And I would defer to the other public officials on the call about that.
Yes, Alderman Lopez, this is Senator Hunter. I'd like to take a stab at that briefly. You know, we have can you hear me?
Yeah, we can. You can.
Okay. There are a tremendous amount of slumlords out there. They're accepting rents from people, and they aren't keeping up with their properties in terms of public safety issues. And so people are going to have to start calling the city, the county, the state government to report them. You know, the only number that I can know in terms of the city, you can dial 311 to report any kind of incident to the city of Chicago. Now that Barbara Jean development, I believe that's a part of the Chicago Housing Authority. And I know that I'm on the south side and that facility is on the west side. And I've been hearing about complaints for that particular site, but there are others that are out there, and cleanliness is the key to protecting yourself in terms of public safety, you know. But all I can say is try to keep your houses clean as possible, your apartments clean as possible, and report to management as well as call in to the City Department of Housing. They will address that issue. They will come out for an inspection, okay? And that's about all I can share with you in terms of that particular issue.
And I will add to this a little bit because is in the district. So
okay.
In terms of Barbara Jean Wright, and I'm glad, Senator, that you mentioned that. So I understand, and I think for people who are watching, the inspection, and you know, there's a number of violations that were given, you know, as we are reporting the cases. So we are obviously now with the pandemic at hand, you know, the inspectors, they have until we come back to, you know, to regular business, hopefully, to, you know, make sure that we verify that they have done this. Unfortunately, they seem to be lagging for what I hear. Now, I continue to hear this case. So like you said, Senator, I think that you're right. We have to probably start calling state, city, county. I know that I hear that county may have a little bit of jurisdiction, at least in terms of the health component, because as you see, the issue when there's sanitation and when we insist that, we have to clean facilities to make sure that there's not, especially common areas and so on, to, address the issue of infections, where we don't want this to disproportionately or spread even more. So I think that on my end, I think I can, commit to work with all of you. Obviously, maybe send also, at least on the city side, send a letter again to the city that I think that is aware of the state, county, like you said, Senator, and then, at least I can commit to send a letter as well to Congressman Davis, so that he also can stand push it hard as well, just in terms of compliance, because like you said, Senator Hunter has said, I believe this is a hot property for what, I think, even in the question it says that is a hot advocate with HUD, so that maybe we can push for more accountability. So that's I think what we can say, and I hope that you can maybe join me on, maybe making this effort, so that we raise visibility.
Sure.
Thank you. I don't know if Commissioner Deere, or anybody else, okay, on this issue.
No, I think what has been mentioned already is quite appropriate. Writing a letter to the congressman, and maybe that's writing one letter, and all of us signing that letter saying that we are with and agree that we need to some additional oversight of this particular property, in particular those that I think that's kind of way out of Mattie's district, but you're welcome to apply. You're welcome to put your name on there. We need all the names we can get.
Yes, absolutely.
But I know that is Byron's district, and it is my district, and soon it'll be Lakesia's district. So I think that it's important, and the biggest asset of our districts are our constituents, and I don't want anybody living in a manner that I wouldn't agree to live in. So we want them to have a safe and sanitary environment, and especially in this time of coronavirus, because I've become somewhat of a germaphobe, and I'm concerned about if you got something that's dirty, corona probably lurking in there somewhere. So I think I'm in agreement with what has been said.
Thank you, Commissioner. I think we can agree on working on a letter we can send to Congressman Davis. Obviously, the more that seems like this has been going on for a long time, but as I said, on the city level, there are a number of violations. I'm familiar with the issue. The violations that Senator Hunter have been given by the reports that the community residents have provided. Obviously, now we have a crisis, but as soon as that, when we come back, and we also keep raising the issue to, like you said, Commissioner, we have additional oversight. Sanitation is a critical component. Making sure that our residents are in facilities that are clean is part of us addressing this pandemic. So as a public health matter, I think we can work together, Commissioner. Thank you. This other one, I think we may have only time for maybe a few more, but at least this one has to do with the environment. I know that in Little Village recently we had a horrible situation. I think that goes to that. In terms of the environment, what are the risks? I think maybe the doctor can help us when this kind of tragedies happen. I know that there was dust, and it comes from like former coal plants, and that was all over the neighborhood, all over the news. And I know that there are other pollutants as well operating. What are the risks involved? I mean, from the public health perspective, maybe the doctor can take on that in terms of, I know that we've been pushing for changing our policy to avoid, more pollutants close to, especially Black and brown communities that are disproportionately affected. Again, environmental racism. But from the public, maybe from the public health perspective, I don't know if the doctor or anyone else want to discuss, the effects of that has, the environment in terms of the health of, vulnerable communities.
Thanks so much, Alderman. Yeah, again, I promise you I'm not trying to dodge the question here. I just want to make sure that it's clear that our agency represents the suburbs. We are obviously aware of the unfortunate incident in Little Village. My understanding is that my colleagues at the Chicago Department of Public Health are working to address that. I just want to say one thing, and it's just a wrinkle to flip your question a little bit, and it's that one of the things we're seeing in the U.S., but also it's more pronounced in places where there's more environmental pollution, and it's that because people are staying home, there's actually less pollution. So there have been, I'm not sure if folks have seen this in the media, but there have been a number of stories talking about how, they can see far off mountains in cities where the pollution completely blocked it previously, and I think it just speaks to the degree to which we as human beings are contributing to the issues around pollution and climate change and so forth. There's one more thing I want to say on sort of a related note having to do with occupational issues. That relates a little bit to the sanitation piece, but the environmental piece as well. And it's that we have received a number of concerns from members of the public regarding violations by employers who are failing to institute appropriate social distancing, or maybe are essential or non-essential businesses that are operating. And we do have a role there. And so generally what we recommend is that folks contact the Office of the Illinois Attorney General, and they sort of make a determination as to whether, as to the type of violation it is, and then they route that to us, and then we do have a role in terms of conducting inspections. That came to us because we've got close relationships with worker centers in our jurisdiction that are really doing great work on the ground advocating for workers. And trying to make sure that, low-wage workers and folks that are doing work that's really tough and can often be unhealthy are protected. So I just wanted to put that out there.
Thank you very much, Doctor. And I think that's right. I think the reports that we hear from people calling because of not enough protections at work, or not respecting social distancing, either by the business or the work environment. I do think that, I'm glad that you mentioned when there's any issues of that nature that they can call the Attorney General, but also I think that 311 is now also taking those complaints, or obviously they can call to the Alderman's office. Our number is 773-523-4100, as this issue is very local, so that we can send investigators to, if there's a work environment that is putting workers at risk, or if there's issues of social distancing. I know that we have heard, many residents saying that sometimes, especially seniors, are now doing senior hours, doing shopping, that maybe that's the time we need to respect those times to avoid the spreading of the virus. So I thank you for reminding us about that call to make the reports. Reporting issues is important so we prevent further spreading. So I know we don't have a lot of time. We have 5 more minutes. So I want to make sure that we have a few more minutes because we started a little bit late, but I want to make sure that we get maybe a few minutes, to wrap up, maybe the last words and a few minutes for everybody, just last advice. So, what else we can tell or advise to our constituents. And again, thank you very much for joining us. I want to start with Senator Hunter. And again, thank you for joining us.
My pleasure, Alderman. And thank you so very much once again for bringing all of us together during these trying times. So I had mentioned earlier in terms of the Black and Brown community, as well as professionals in the field and researchers who have access to information, we must come together to put together an infrastructure that we must build for a healthy community. This is a Black and a Brown community. Racial disparities is real. Disproportionality is very, very real. And we must put together a system that is evidence-based, and the government officials higher than us, the mayor, the governor, the county board president, the president of the United States, they got to put the resources behind whatever plan is put together to address the issues in our community. We have housing disparities, we have environmental disparities, we have health all kinds of health conditions in our communities. And so the system is not set up to address those issues. We need preventative measures. All we do is treat. We do not solve no problems. We do not provide any kind of prevention services. And the few prevention services that are out there simply are not enough. Okay. And so we need cures. We need cures and stop treating problems. We need to prevent them from happening and move on with our lives and our communities.
Thank you, Senator. I think that speaks directly to some of the questions that came about housing and making improvements and bringing those resources to our communities so that we prevent, spreading, and we really bring justice to our communities that have been neglected for a long time. So thank you, Senator.
Thank you.
Commissioner Deere.
All right. Again, I'd like to say thank you so much, Alderman, for putting this together. It is always a delight to work with you. And we've heard some excellent information today about the impact of coronavirus on the Black and Brown communities. And I would just say that the fight is just starting.
Yeah.
And we have to continue to hold up, as my mom often said, the bloodstained banner. It is important for us to, as African Americans and Latinx, that we are making sure that we are sticking together. We're better together. And we have to work on this together, fight this fight. And it is a hard fight, and it's just getting started because at the end of the day, this is coronavirus, but these disparities have been going on for a long time. And so we have to fight the cause, stay together, and we will always be better together. God bless you all.
Thank you, Commissioner. Dr. Joshi, if you maybe last words.
Thank you so much. I would just echo Commissioner Deere's comments in that we got to fight this thing. Nobody could do it alone, and I'm confident that together we can move forward. So thank you so much, everyone, and thank you, Alderman Lopez.
Yeah, and last but not least, Lakesia, I know you're doing a very amazing work, and former healthcare worker, and really excited about what we're gonna do, all of us together, bringing communities together. I think this, start showing, how we can fight for these resources. So last but not least, Lakesia, maybe you're gonna wrap us all up. I think you're muted still. Sorry, I think you're muted.
Myself. Okay, can you hear me now?
Yeah,
So I would say that I agree with everyone that we have to stick together. This is so important, the moment that we're in right now, even though a lot of us have already been a part of these fights for years, but sticking together right now is so important. I just want to really encourage that if you know a healthcare worker, whether they be in hospitals, nursing homes, personal aid, a personal assistant, so please just keep them in your hearts. Call them, tell them that you love them, that encourage them on a daily, because right now we have a lot of healthcare workers who are afraid to even go to work, or have loved ones that they're taking care of who are at a high risk of catching the virus, and they're afraid to take it home to them. And workers are literally making a choice to whether, take care of their own families or going in to take care of the most vulnerable population. And that's something that no one should have to do, but these are decisions that workers are making every day. I just spoke to someone a worker last night, who said, my son has asthma. My son has asthma as well, so I understand as a mother. But the worker said that her son has asthma, and yesterday was her last day going to work because she just couldn't risk it. And the fact that a lot of these nursing home owners are not being honest with the workers about the positive IDs in the facility, and the workers having to find out you know, by watching the news or reading a newspaper or just hearing word of mouth or finding out that their coworker have died because of complications of COVID-19. So I just encourage you all to check out the stories. They are posted on SEIU Healthcare Illinois, Indiana Facebook page. So if you have time, just check out the page, listen to these workers' stories that are speaking out courageously about what's happening in their facilities. And I look forward to continuing this fight with all of you. Thank you for having me today.
Thank you. And like, you know, I just want to end with some of the words. I know Commissioner Diaz said that this big fight is kind of beginning, right? And I think that we need to all push the same direction. I want to thank you for the information during these difficult times. I know people out there really appreciate, you know, having information and resources, especially now more than ever. You know, I believe that we're the city of big shoulders, the county and the state of big shoulders, and we shoulder to shoulder. You know, we got to advocate for our community. So thank you again. Like we said, you know, in Spanish, sí se puede. So I know it's tough times, but, you know, I'm really honored to work with all of you, and we'll keep working together. Thank you again for joining us, and I will be in touch. Thank you.
Thanks so much.
Thank you.
Thank you,
Thank
Alderman.
you.
Bye-bye.
Thank you,
you.
Alderman. Appreciate
Thank
you. Bye,
Thank you.
everyone.
Bye, everybody. Thank you.